Hi Bruce, this is your 1-week follow-up from your mini gastric bypass with Dr. Robert Rutledge. Do we have your legal permission to put your video on the internet?
Yes.
Okay, so do you want to tell us how your surgery went and how your week has been?
The surgery went very well. I had my surgery last Wednesday. Today is Tuesday. Last Wednesday morning, I was the second one in, and things apparently went pretty smoothly. My surgery was about 51 minutes. With about a 7-foot bypass and extraction of the lap band that I had before. And recovery went very well. This whole week has been well. I had very weak after I got out of the hospital and was in recovery, but my strength picked up during the week. I had very little pain at all, just a little bit of tenderness in the stomach where the incisions were, and a little bruising there, but it was very minor, hardly any pain whatsoever. And so as the week has gone forth, I've picked up a lot of strength and feel very, very normal actually. So I've got so I lost 10 pounds over the past 6 days, and so it's gone well.
Okay, so we took out your lap band. Can you tell us when you had your lap band in and what the procedure was to have the lap band?
Right, so I had a lap band back in 2006, so 4 years ago. The procedure to get the lap band was a little bit similar, but not as rigorous as the MGB, in that you had to go through and meet with a nutritionist. You had to have a psychological evaluation. You had to fill out a lot of paperwork acknowledging that you understand risks and so forth. The procedure itself was also very easy. It was done laparoscopically, so I have a number of other little scars besides the ones that I got from the MGB. I was in the hospital overnight, released the next day. Again, very little pain. There was quite a process that I went through to get the fill in the lap band optimized, I guess, to the point where it didn't let food just drop through it. That seemed to be there seemed to be a lot of maintenance involved in that. It did feel very restrictive at points in terms of what you could eat and what you couldn't eat. There was a lot of follow-up in terms of injections and getting that fill right.
How often were the fills?
Fills would be about every 2 weeks, is what I recall. And when you came into the office, they'd test you by drinking water kind of quickly to see if that caused if the water dropped or didn't drop pretty easily. And then they do bariatric barium swallows, where they do under an X-ray, where they also look at it. I have to tell you that I did lose weight under that, mostly because of the diet that I had to be on before and after, which is mostly a very protein kind of oriented diet, a liquid diet. I lost probably 45 to 50 pounds after that procedure over the next 6 to 7 months. However, after the band was optimized, I didn't feel like it was that restrictive. I went in and to the doctor and told him that, and I was kind of berated by the doctor, by the physician's assistant, not the doctor, the physician's assistant, who did most of the aftercare, the post-op care, that I wasn't doing what I needed to do, and I needed to, not eat as much and so forth. And I kind of said I thought that was the whole idea why I got the lap band, is it was supposed to restrict me from eating as much as I ate. And it told me that if I continued to eat like I was eating, I'd kill myself, by stretching the band, which wasn't, I thought, a very great thing for you to be saying to your patient, especially after a procedure of that type of procedure where it was, essentially sold as this is something that will help you restrict your diet, restrict your caloric intake. And when I was just being honest about, I didn't feel it was that restrictive, I kind of got taken to task for it.
Right.
Needless to say, I never went back to them after that. I never saw them again. The lap band, it was at that point very soon, the effects began to reverse, and over the course of the next, say, 3.5 years, I ended up gaining back everything that I'd ever lost.
Okay, so now you're also a diabetic, and it seems like during that time were you still a diabetic with the lap band?
No, actually, I was not diabetic at that time. I'd only been diagnosed as diabetic about 3 months ago.
Oh, okay.
It was actually after I started in the process of going for the MGB that I always have physicals every year, and during the course of my preoperative examination with my doctor for this, did my doctor say, and he felt I was becoming pre-diabetic, that I was actually diagnosed as being diabetic during the preoperative process for this.
Okay, so can you compare what it was like to eat the first week of the lap band compared to the mini gastric bypass? Were you able to eat as much with the lap band as you are with the mini gastric bypass after surgery? And
well, it's very difficult because after the lap band, you're only allowed a liquid diet completely. I mean, this is liquid as well,
right.
But I could have, I've had some grapes, I've had some watermelon. That could
crackers,
be crackers,
yogurt,
good Cheez-Its.
So it's solid liquids after the lap band for how long?
It was a couple of weeks, and so I had basically protein shakes, that type of thing. So after the MGB, it seems like I've been able to eat more normally right afterwards. Right. I was surprised I was eating soup like the day after. So. And yogurt. Been eating a lot of yogurt.
So how did you hear about the mini gastric bypass?
A friend of mine at work, associate of mine at work, had it done a year ago last May. And he also has 3 family members that have had it. I know them as well. And so he and I have engaged in discussions pretty much the beginning of this year, so it's August, beginning of this year, I'd say, of 2010, where we talked about it off and on, and I started to explore it, went into the website, watched a number of the videos, talked to, again, him and his family members that have had it. They have all, so I think one of his family members has had it a number of years ago, 2 or 3 years ago. So, and they've all lost, in excess of 100 pounds. My friend's lost 85, but his family members lost in excess of 100 pounds.
And have they kept their weight off?
Yeah.
Over a period of 3 to 5 years?
Yeah.
Okay, great.
Yeah, they've kept their weight off.
Okay, great. You got anything else to say, Bruce? You like to say anything else to anybody out there?
So far, it's been, it's only a week, but it's been great. And
you'll be back in a year for your follow-up? Hopefully.
I hope to be.
Okay. That's the plan. Okay, well, thank you so much.